Good afternoon and good evening, everyone. Thank you so much for joining us for the University of Warwick Masters in Public Health and Health Promotion Information webinar. Thank you so much for joining us during such a challenging time where all of you are so busy and have such hectic work schedules. So we really appreciate it. Just a running order for today. Our Head of Academic Affairs, Mr. Dermot Brannock, will be running through just a PowerPoint presentation on the curriculum, on the tuition fees, all the frequently asked questions about time commitment, all the things you really want to know about local recognition, etc. So he'll be talking about that in detail, but we will also talk to one of our tutors and academics on the programme and one of our participants, our current physician participants on the programme who's currently studying, to get their insight and their thoughts as well. So that's the running order. So I'm going to hand you over to Dermot, who will begin the presentation or the programmatic overview.
Brilliant. Thanks so much, Rebecca. I'm delighted to see everyone here on the programme information session. What we're going to try and do is give you enough information that you can make a very informed decision about the programme and give you hopefully a really good flavour of what this programme is like to study. So if you bear with me 1 second, I will share my screen. And right, perfect. Hopefully you're seeing my screen now. So what you'll see, I suppose there's two things at the start to point out about this programme. One is all master's programs have a particular area of focus. Some have a focus on epidemiology, some have a focus on infectious diseases. We have very much put a focus on this master's program on health promotion. So it's an MPH, it's a Master's in Public Health, but ours has a particular focus on health promotion, which we think is contemporary and gives enormous value to health systems. The second thing you'll notice is you'll see iheed alongside the University of Warwick, and the University of Warwick needs less of an introduction, but to let you know who iheed are, we are an Irish education organisation. We are part of the Cambridge Education Group in the United Kingdom, but we're founded by a family doctor in Ireland in 2013. And since then, we've worked with healthcare ministries and governments across the Middle East and South Asia to increase capacity in their health systems. So that is everything from suites of CPD programs in the likes of Qatar and Saudi to family medicine academies. And particularly, we have family medicine residency training programs, Mint FM in Malaysia. We have ones in maternal health in UAE. We've got family medicine academies in Saudi. And really, what our specialism is online medical education. So we have a deep expertise in how people learn online and in what makes a compelling, interesting online program for people to study. And since we've been founded, we have had over 400,000 course completions on our online platform since 2013. And as I say, that's everything from CME right up to master's programs and residency programs as well. The award that you're studying for, though, on this program is a University of Warwick award. And we work in partnership with the university to bring this qualification to a global audience. Warwick are an absolutely phenomenal institution, and they are a powerhouse in public health. They are ranked 8th in the United Kingdom as a university. They're ranked 62nd in the world. The Russell Group of universities in the United Kingdom is the top research-orientated universities, and they are part of that. They have strategic alliances then with the likes of Monash University in Australia as well. The campus-based Masters in Public Health that Warwick have is ranked 3rd in the UK and it's ranked 12th globally. So the pedigree and the expertise that Warwick bring to public health is phenomenal. And the leadership team on this program and on their campus-based program is the same leadership team. So the expertise that sits over both is the same. And I think what's important is that the qualification you get at the end of this program is the exact same qualification as you would get on any other Warwick program. It is a University of Warwick award. It's at master's level. It's level 7 on the framework of qualifications in the United Kingdom, which is master's level. Importantly, though, it does not mention anything to do with iheed. It does not mention anything to do with online learning or distance education. It's simply a master's qualification, the same as any other that they would offer. The mode of delivery doesn't impact in any way on the standing of the qualification. So what this program is trying to do then is over a 22-month period, and that's broken up into 3 semesters, we're trying to provide you with a really, really outstanding academic experience that gives you a depth of expertise and confidence in public health, and also do that on an incredible online learning environment. And we'll see later on in the presentation exactly what that looks like and what it feels like to be a part of. The team behind this program, and I think one of the beauties of a team of an international program like this is that we draw people as faculty from the University of Warwick, but also from other institutions around the world. So the contributors to the program, this is only a small portion of them. We've got Sadaf, who's based in UAE. Saran is the course lead in Warwick. Katie Reid has worked extensively in Africa through her career and was the MPH course director in Manchester for about 2 decades. People like Tim in the BMJ is based, ironically based in the US. Ulrich has an international profile in public health. And then we have tutors on the program from Qatar, from Malaysia, from Australia. So, what you get is the very best of the curriculum from Warwick, which is aligned to the UK Faculty of Public Health, but also then international perspectives in the delivery of it. So in terms of what the program actually covers, so we've got the program split into 3 modules, and there's 3 exit points to the program. The first is you've got semester 1, which is a postgraduate certificate. And this is very much the basic sciences of public health. And this content is mapped to the Part A syllabus of the UK Faculty of Public Health. It's mapped against the requirements for the licensure exams as well in the UK. But really what it's trying to do is module 1, which is 6 weeks long. So we've got 3 modules here, each of which are 6 weeks in duration. Module 1 is really trying to give you an overall perspective on public health. And it's an introduction to lots of areas that we'll come back to in future modules. So we're looking at the global burden of disease. We're looking at environmental health, at communicable disease control, which is extremely relevant, and policy and action around public health. The second module then is really looking at, the second and third modules are looking at how policy and how data can transform the health of populations. And so in module 2, we spend a lot of time on the analysis of data. And for anyone looking at the weekly content here saying, statistics, I'm not wild about that, it's never been my strong point. I think what's important with this module is it's not attempting to get you to create the statistics that we'll be using. It's all about analysis. It's all about being able to look at a piece of evidence and judge the quality of it, judge the relevance of it to your context. So it's looking at data saying, well, what does this do for the number needed to treat? It's looking at a confidence interval and saying, well, do I understand what that means? Or if I'm looking at a forest plot, do I understand what's going on? So it's very much looking at being able to critique how studies were designed and be able to analyze the data that comes out of studies. Society and politics and the influence on health, we we have seen all too tragically with COVID over the last 2 years, the exact influence that society and politics can have when you've got different responses to a pandemic. And what we're looking at here is everything from health inequalities, and that can be everything from access to vaccinations to any element of it, politics and what that does, how individual behavior and psychology impacts health, and then infrastructure as well. So there's a really good range of kind of basic sciences looking at human health and disease and control of disease and environmental impacts done in the first semester. The second semester then, which again is 6 months long, the second semester is really looking at how the conditions in places where people live, learn, work, grow, play affect their outcomes. So you're looking at health promotion, and one of our colleagues at AF would say that the majority of gains in a health system are not from the reactive curative model of health. They're to be gotten from health promotion. They're to be gotten from having better infrastructure and better ways of empowering and motivating society to have a healthier life. So you think of chronic disease management. The goal in chronic disease management isn't to treat retinopathy in diabetes, it is to prevent people from having retinopathy. It's not to treat cardiovascular disease, it's to have people live healthier lifestyles that then don't go on to develop cardiovascular disease. So looking at areas like individual and societal change, looking at how to do health promotion, how to evaluate health systems organizations is incredibly important. The second module in the semester, so module 5 overall, is looking at really some of the more contemporary areas in public health. So gender and race, climate change, major events, mental health, all of these are really, really contemporary areas in public health that need to be really at the forefront of what a modern public health practitioner is doing. And then the final taught module on health economics and policy and financial management is really saying that you'll have learned across the first 5 modules how to very persuasively put plans in place that will improve population health and public health. But really, unless you understand the organizational and political and leadership situation that you're operating in, you probably won't be able to influence that into actual action. So understanding how healthcare systems are funded, understanding the competing interests, understanding organizations and teams and what drives change and where does resistance to change come from. On a very practical level, being able to word a policy paper and a position paper such that it will have impact is extraordinarily important. So while the first number of modules really are getting your the science and the art of public health and giving you a lot of confidence in that, this module is looking at you as a leader and looking at you as someone that can influence and persuade and that understands the financial and economic implications of the work that you're doing. So across the first year of the program, which is these 2 semesters with 3 modules each and 6 weeks in each module, so really well paced, this gives you a very, very comprehensive grounding in public health to be a public health practitioner in whatever type of public health role you want to go into. The third semester then goes into research in public health. And this is structured into 2 different blocks. One is an 8-week taught module, which is covering choosing a research idea, reviewing the literature. So really, what's the question I want to ask? What's the best methodology to answer it? Preparing a research proposal, getting that approved, and then ultimately writing your submission. Now, the piece that I think is really, really innovative by Warwick is that the output of that research project, of your professional project, is not a 10,000 word dissertation. It is a 4,000 word journal article and a conference poster presentation. So you end up with something that is very practical and a very tangible output of your qualification. So, I think as an assessment method, it's very, very innovative. So what I'm going to look at next is just actually the content is really contemporary, really up to date, and delivered in a way that's really engaging. But actually, what I want to talk about now is how does it work, and what does that feel like to you as a participant? So the first thing is we'll give you a really...
Just to let you know, speaking of participants, that are Reid and Samina are with us now.
Yeah, perfect. So I'm going to jump onto them in a second. Brilliant. So we'll give you a really, really comprehensive online orientation to the program, and that will get you comfortable with everything from the supports that are available to how to use the online platform, to knowing who's in your group, who your tutors are, etc. So you get really comfortable before you start week 1. And then each week then follows a similar pattern where you've got a weekly discussion forum. And that is where we'll give you a case scenario about an issue in public health, and you'll contribute to that during the week. You will then go through the online content in your own time during the week. And the online content is a phenomenally good platform to learn on. It is really interactive. It is very, very visual. There's lots of animation, there's lots of video, there's lots of explanations of everything in it in a way that's not reading kind of flat PDFs or PowerPoints. It's it's very immersive. It should never feel like hard work to go through the content. It's full of video animation as well. So it's a very enjoyable kind of weekly experience. And then towards the end of the week, so on a Thursday evening or a Friday afternoon or a Friday evening, depending on where you are in the world, you have your weekly tutorial. And that's the part where we come together with a tutor and with a group of 20 participants to really bring the program to life. And I'm going to pause the presentation here and bring in, we've got one of our Module 1 tutors, Samina Hasnain, on the line, and we've got one of our students, Dr. Reid, as well. So great to see you both, and thanks so much for joining us. Dr. Reid, if I can start with you, actually, would be great. What, oops, sorry, I muted you there as you unmuted. What drew you to a public health master's?
Samina or Arij? I didn't get
Sorry, Arija, yeah.
Yes. So, hi all, first of all. So this is Arij from Jordan. So I have joined this master degree because my background, I'm a pharmacist, and I was looking for something that boosts my current career. I am one of, let's say, the humanitarian actor in Syria since the Syrian crisis started, and since 2017, I'm working with one of the international NGOs. We are like working in the camps in northwest of Syria, boosting, let's say, the health situation in those camps. We are responsible of over 100,000 of individuals there. So this is not easy thing that,
No.
So just, it's always, the situation is like, let's say the context is a very fast context, changeable context. So with the COVID-19 pandemic also, many things changes on the ground. And I was looking always for key things, for new tools to detect, to make the situation more comfortable for those people who are living in tents. So I found myself in this course.
Brilliant, brilliant. And it is a phenomenal body of work that you're doing. And I think one of the things that always strikes me about public health work is the very human impact that it can have on an enormous scale. You know, an individual treating an individual, there's huge reward to that as well. But obviously, you know, the impact that you can have in public health is it's at a population level, and it's yeah, I'm in awe of the work that you're doing, if I'm honest. And how, I mean, you are only at the start of the program, you're a number of weeks in. How have you found the adjustment to working full-time and studying part-time? How have you found that experience and the platform and all of the experience of it?
Well, to be honest, what attracted me in the beginning, the time and how the scheduling of this master is done. Because, you know, I'm fully busy among the week, and here in the weekend, the weekend in Jordan is Friday and Saturday. So I didn't ask them. They put me, for example, in the group of Friday, which is comfortable to me, that I have full of day, that I can attend the live sessions, I can answer the discussions, currently I'm busy with my assignment. So yeah, this was very easy. And let's say also the platform of the master degree is very reachable. We can also, the resources are available. So I could manage by my work and with this master degree.
And that's brilliant. And I think we spent a lot of time designing this program as an online program in the first place. And I think there is a big difference between a program that was a campus-based program that, because of COVID, people have put online, to actually starting with a blank piece of paper and saying, okay, we're going to design an online program. Our audience are all going to be full-time practitioners and professionals. Most of them are going to have young families. And, you know, so they'll be balancing work, family, and study, and being able to, you know, if the program isn't designed that it can slot in neatly with that, it just won't work. People won't be able to complete it. And I think that's one of the reasons I think that this program is so popular, is that it allows people to maintain all the other things they're doing, that they don't have to stop anything to study the program. How have you, and I'll bring Samina in here as well, how have you found the weekly tutorials? How have you found the part where you come together each week with your group?
Well, I believe that let's say the multi background that each group contains, this also gives the strength of this master degree. Because for me, for example, in my group, I'm the only one from Jordan, while the others are from outside. Yeah. So this also, the online or the live discussions is very important. We are kind of changing the context between each other and bringing more ideas and points. In our current context, you can just realize what's going there in this country and what you are doing here in your country. The exchange of knowledge between us, this is very important way and good point for this.
I think you've hit on a really, really important point. And Samina, if I could ask you, you have a background in public health. What do you think the benefit of that international and interprofessional mix within a program group is?
So hi everyone. I have actually been really enjoying the discussions during the weekly tutorials. Again, there's people from diverse backgrounds, diverse educational and work experience, and really it does contribute to making it a very rich and fruitful discussion at the end of the week. I like how we are, as compared to some of the other master's programs, I like how we are broken up into groups of 20, because that means that you can really kind of draw in everybody into the discussion, whereas when you have very big groups, it's a little bit difficult to do that.
Yeah.
And it feels like you have a more like personal contact with each one of your students that you are teaching during the tutorial.
Sorry, go on. No, I think that's really, really relevant. I think keeping the group size small and keeping it that there is a safe space for discussion, that you get to know your group well, that you get comfortable with who they are, and they get to know you as a tutor, they get to know each other. And module 1 is very much about forming that group and getting comfortable. By the time people are at module 5, 6, 7, they have made a network of colleagues for life. And it's what I love to see on the programs is the alumni that still keep in touch all the time. And the groups, each group of 20, they've all got their WhatsApp groups, they're all in contact with each other, they're all supporting each other. So to Aisha's point, when it comes to the assessment, everyone's helping each other. There's a lot of support and guidance. And I think that when you're doing a part-time master's program, it's incredibly important that you feel part of a community, that you don't ever feel that you're kind of alone in that journey. That if this was the 1990s or the 2000s and you were studying a distance learning program that they used to be, that was a very isolated, lonely experience. Whereas we've gone and we've made sure that all of the best parts of being in a campus-based course are done in an online environment. So you've got the small group teaching, you get to know the same people. There's there's going to be kind of hot topic sessions with global experts dropping in. There's you meet your program manager every single week on your tutorials. There's always somebody to ask questions of. And I think those touch points are incredibly important. But Samina, there's one of the questions we always get asked is about kind of career trajectories in public health, and what's your experience of the breadth of areas that people can go into in public health?
Well, I mean, I can talk about myself. My career itself has taken a lot of different trajectories. If anybody told me in medical school that I'm going to be a public health specialist in the future, I would have never believed it, because it was nowhere on my horizon. So I started off with doing a residency in internal medicine. And by the time I got to the last year, I already had a deep feeling that this is not the way ahead for me. I'm not happy in it, where I am. And I told people this as well, that if you're not happy or fully comfortable in what you're doing, you've got to make a change. You've got to take the step to explore different options. A lot of people, they don't look at all the other different options that there are, and they just want to, they're always think that okay, now we've done this, we just want to go on to the next step in the same path. So I left internal medicine and I joined the Ministry of Public Health. Again, when I joined the Ministry of Public Health, I joined it with the mindset that I'm not going to stay in this for long. But I did end up spending almost 9 years in the Ministry of Public Health in the Communicable Disease Control Department, and I did my master's while I was working as well. So, and I loved it. I loved every step of it. We've had different outbreaks, different epidemics, and now we had the COVID-19 pandemic. So what I loved about it was that we're constantly learning we constantly had to face new challenges. There was never especially in communicable disease control, there was never a static moment. We were always on a like, you know, kind of like, okay, one outbreak is over, there's another one starting. So you, that suited me very well. I did, when I did my master's in public health alongside working, it was kind of like, I really enjoyed it because it was parallel to what I was doing at work. It was very relevant. And so, I mean, and I enjoy teaching. So you have to, I'm not saying that clinical work is something less, but it was just not for me at that time.
No,
You know, and
I think the two can actually sit alongside each other in terms of a person's area of interest quite easily. And I think there's lots of people that, you know, be they working clinically or be they working in research or
right.
in other areas, that the public health perspective really helps their career. And we, you know, what we have seen with the work we've done with ministries is they generally want people to do a postgrad qualification in either research, education, public health. You know, they want people to have a kind of a developmental track. But if I can come back to Dr. Iheed, how do you find the so far, and admittedly it's early in the program for you, but how do you find the relevance of the content that you're studying?
Well, to be honest, in the beginning, let's say for me, because I have a huge work during the week, so just going into the terminologies and the papers, the documents, in the beginning, let's say, but after like interacting with colleagues, after interacting with the iheed staff, let's say, it's much more easier now, and they are always reachable. So the context is very rich, and you can like kind of waving on those resources and information that we are having every week during the tutorial.
Brilliant. And do you see that the program is going to have a positive impact on the work that you're doing? You know,
for me, to be honest, I'm focusing on the kind of analysis, and now this is what we are having currently. And of course, because as I told you, I'm working remotely, focusing on the core or the main core of the health promotion. So, of course, because I'm really seeking for more tools, and this is what I'm gaining now and what I'm finding now in this course.
Brilliant. And would you have any guidance for somebody that is potentially thinking of coming onto the program? How would now that you're into it, what guidance would you give someone that's considering it?
I'm always saying that try. Don't say no, I can't, or I don't have time, or how I will manage. I swear, for me, and maybe I'm the most busy girl in this world with my work, and I'm even traveling. By the way, sometimes I have trouble with my work. But try, don't say no, I will not, or just rethink. Always try to give a space for yourself, develop yourself. Don't always depend on your career that they will develop you, that you will go on a higher step. No, do it by yourself.
I think you're absolutely right. I think it's you know, education is one of those things that it opens doors for you. And sometimes you have a very direct plan of what you want, and other times there's opportunities that come out of education that you haven't predicted. But ultimately, it's a step that the person has to take themselves. And I think you're absolutely right. And I think within that, you know, it's achievable. You know, the people that we have on this program are, you know, they are doctors, nurses, pharmacists, dietitians. You know, they're all highly qualified. They're all interested in public health. They're all motivated. Everyone's chosen to be here, and I think that makes for a very nice group dynamic, for sure. But what I'm going to do, I'm going to go back to the presentation now in terms of the.
Just before you finish there, I suppose I want to just take the opportunity to say how delighted we are that Samina is with us today, and we didn't get to give her a proper introduction, and she is one of our subject matter experts and our tutors And I think she's so modest herself that her background explanation isn't half of what she has achieved. So I just wanted to say that Dr. Samina, you've over 9 years working in communicable disease control in the Ministry of Health in HMC, or Hamad Medical Corporation, for those non-Qataris here with us today. You're a subject matter expert for online vaccines, management training program in HITC in Qatar, chief editor and author of the National Immunization Guidelines in Qatar. You are training of vaccine providers in cold chain management. You're one of the senior supervisors with COVID-19 track and trace team in Qatar. So you're very bored at the moment. You have absolutely nothing to do. But I just wanted to give Samina the biog and profile that she deserves, because it's indicative of the type of tutors that we have across the globe. We have people from Johns Hopkins, from Harvard, from Cambridge, from the UK, from the US, from Qatar, from the UAE, to Malaysia, to Australia. And it's that wonderful wide variety of insights into localized challenges, and not just with the pandemic, but with public health across the world. And as Arjeel just alluded to, I think that's the really nice secret sauce of this program, that there's so much interaction from experts around the world that it makes it a much nicer experience. So I just wanted to give you that introduction, Samina, before Dermot went on.
Thank you so much. Thank you so much for your kind words. And I just wanted to add, like, that even when I was doing my master's in public health, Arij, everybody around me, there are a few people to encourage, but a lot of people to discourage, that you won't have the time, it's not worth the money. I can tell you, it feels like a tough, maybe in the middle, but it's worth the time and the money. And when people tell you that it doesn't, like, you know, public health and other medical fields are separate entities, sometimes you'll hear, well, you have a clinical brain, you don't have a public health brain. None of that is true. So you don't need to, like, there should be a marriage of all of public health with clinical health. They can't work without each other.
Thank you, Samina. I listened to many voices that disappointed me, but I didn't care, especially for the money wise, but I didn't care.
I think whenever anybody like tries to step forward, there's a lot of people who try to pull you back, and a few people that are actually ready to lift you up. So you just kind of have to ignore the background noise.
Thank you. Thank you.
No, completely. And, you know, I think on that theme, I think that is where the group size and the cohesion of the group comes into it, that it's really important that, you know, you belong to a community of learners that are on a journey together. And I think fostering that is extraordinarily important. So just, I really hope that the last few minutes have given you a sense of actually what does it feel like to be on it. So, you know, in terms of what it means for someone to be on the program, I think the first thing is, you know, the small group size. Oops, sorry, I've gone back one too far. The small group size is incredibly important. It builds that culture and those relationships with your peers. The pace of the program is just right. It is, and we survey people on this all the time. Everyone's a full-time professional, everyone's a part-time student. Everyone wants to get the program done in the most efficient way possible. And we think that the six-week modules for the taught component is just the right amount of pace, that you're busy, but you can manage this with your clinical or your professional workload every time. And, you know, people are able to commit to the program. The underpinning that then is really, really strong support, that you have support from your tutors, from your program leaders, from your program management team that you see every week. So there's always somebody to ask a question of. So I think being a participant on the program, it's a very enjoyable experience. On this slide, what I've got, we we issued, we've had actually, it's closer to 700 now people on Warwick programs in the last, since 2019, from literally all over the world, everywhere from South America to New Zealand and in between. We've 96% student engagement, which is phenomenal. The vast majority of people that come onto the program are able to engage with it and get through their studies. The last two statistics are actually from the current group that Samina and Dr. Iheed are involved in. So we did, at the midpoint through a module, we just did a really short survey as to, look, how are you finding the tutorials, the platform, the support, and would you recommend this to a friend or colleague? And the results are incredibly positive. I mean, I think what we have is groups of students that feel very, very looked after. And I just popped up some of the quotes that they gave us within that really short feedback survey. And that is indicative of that is indicative of feedback that we get all the time in programs. It should be a very enjoyable, accessible, achievable experience that you get. So in terms then of the kind of the nuts and bolts of the program. So in terms of joining the program, as you've heard, we've a very wide international and interprofessional mix of people on the program. The entry criteria are really, really straightforward. You need an honours bachelor degree to come onto the program, and that can be really in any field, but obviously you're going to want to have an interest in public health. And the majority of people on the program they're either clinicians, doctors, nurses, pharmacists, or allied health. And then we do have a few people that are involved in health systems management on the program. And so that the different perspectives that you get are really important. You're not coming to the United Kingdom to study, therefore you don't need a Tier 4 visa, and because of that, you don't need a formal English language requirement, a test as a requirement. So you do, however, need to be able to complete the program conducted through English. So you need to have good conversational English, and you need to be able to write your essays that you have to, and your assessments that you have to write through English. So what we do for the application process is we'll ask you for a copy of your degree transcript. We'll ask you for a personal statement as to why you want to come onto the program, and that helps us with this English language assessment. Then we'll ask you for either an employer or an academic reference letter, and that says that you're a professional in good standing, and we'll ask you for photo ID, and you upload all of those onto an online platform, and that's it. I think the bit that is important is the places on the program are limited. So we'll put you in groups of approximately 20. And at the moment, we've got 3 groups of 20 running in parallel. Maintaining that group size and those ratios that enhance the feeling of community on the program is really important. So the program spaces are allocated on a first come, first served basis. So the people that get their applications and deposits in first get the spaces on the program. Similarly, for the next program in March, we will have 3 groups. We will have 20 on each group, and they are bound to fill as well. So in terms of program fees, this webinar is positioned at people that are in Malaysia and people that are in generally in Africa, and there are quite substantial bursaries available from the university and from the Malaysian Medical Association in particular. So the price of the Masters is £9,000 or £5,000 for the postgraduate diploma. There are very considerable discounts if you register early and if you go for one of the more upfront payment options, which can reduce that down to 8,000 and 4,600. So Warwick, they very much have a social mission with this as well. They want to make postgraduate education more accessible. So we're absolutely delighted to be able to bring the program at those price points. So I'm going to finish up and move to questions in a minute, but effectively the output of this program, you know, you're getting a very prestigious award from top 10 UK university, and it's delivered by absolute experts in public health. It meets the academic requirement for if public health consultancy is your route, it meets the academic requirement for that. It's excellent preparation for the Faculty of Public Health exams. And again, if that's your chosen path. But I think there's a lot of transferable skills. There's an awful lot in public health that is relevant to any career path that you take. And that is around analysis, research, synthesis. And you know, this program gives you a really unique blend of research, of inquiry, of action. The assessment is all practical and very authentic. But you know, I think more to the point is, you know, it's bringing people together from a range of disciplines and backgrounds and different perspectives to, you know, look at the root causes of health problems and give them the skills to develop very, you know, innovative solutions, long-lasting impacts on population health. So, you know, ultimately at the end of this, it's a 22-month master's that's split between a 6-month cert, a 6-month diploma, and a 10-month master's. At the end of that journey, you know, we're aiming to produce really highly skilled graduates that are capable of addressing public health problems at a societal level. You know, in doing that, you get local recognition, you get CPD as well as the academic award. You get to do it through a program that is part-time. It's designed that everyone is a full-time professional. And you know, what you only get a tiny flavor of on a call like this is there's a lot of back and forth with your tutors, with your program managers. The warmth of the relationships that are developed are fantastic. So it's a really, as a master's program goes, it's a really enjoyable experience. So it would be fantastic to take whatever questions you have. We're delighted to answer them. And likewise, fantastic to see people interested in the program. So I think sincere thanks to Dr. Iheed and to Dr. Samina for their contributions. And yeah, over to the floor for questions.
There are no questions really, to be honest, Dermot. I think we covered everything in terms of your presentation, in terms of fees. I will stipulate again that there is the LMIC pricing, and that there is that quite considerable reduction if the fees are paid before the deposit is paid to secure your place before the 17th of December. And just to reiterate that, as Samina quite rightly pointed out, we pride ourselves in very small group sizes. We never go, you know, in the region of around 20 per group size. So as a result of that, we do cap each region and each time zone, and they are filling fast. So if you are interested in joining the program, I would advise that you get your application and your deposit payment in. And before the 17th of December, if you can, just because you will be able to get a significant discount as a result of getting your deposit in by that date. But just to let you know that the recording of this event will be sent out to you by email later today, and also a link to apply and a link to pay your deposit if you so wish. You will also be getting a call from one of our education advisors from a UK, a +44 number. So if you see a number come up on your phone that you don't necessarily identify, it will be one of our team. And they just want to reach out to you, to talk to you in person, to see if you have any other questions, and if you need any help or assistance in making your application. So thank you so much for joining us today, and special thanks to Samina and Iheed for taking time out of your very busy schedules to join us today. And thank you to Dermot. So thank you so much, guys, and hopefully we will see you very shortly on the program in March.
Thanks very much, everybody.
Thank you. So
Bye.
Nice to meet everyone again.
Thank you. Good luck for all.
Thanks, Samina. Thanks, Iheed.
Thank you.